As the health service faces its annual winter test, ministers want your smartphone to replace the receptionist phone as the starting point for how we engage with the NHS. Health Secretary Wes Streeting putting an app upgrade top of a list of reforms to be set out by the Prime Minister this week.
The NHS should feel as easy, convenient and modern as the other services we use in our lives. You will see a wide range of reform we're putting in place to modernise the NHS, to give it the tools to do the job, to bring it into the 21st century so the NHS doesn't go the way of Woolies and collapse, but is actually a service fit for the 21st century.
An app that became ubiquitous during the pandemic uses private tech providers beneath its NHS umbrella. One supplier who already distributes hospital test results via the app says it's well placed for transformation.
I think the NHS has taken a really good approach to bringing the best technology providers under the brand that the British public trust, the NHS app. So they start with appointment booking. They've got a bunch of suppliers that allow that. They've now reached 85% of England's hospitals. The next thing is their medical record, so seeing your test results, having your care plan.
The Doctors' Union is sceptical technology can address more fundamental problems.
I am positive that we focus on technology because we have to do that, but it's important to remember it's not the be-all and end-all. And many of my patients are elderly and vulnerable, don't have a smartphone, sometimes don't even have access to a mobile phone or a computer. So they won't be able to take advantage of this, and they're the ones who may be left behind.
The challenges facing the NHS are never more apparent than at this time of year, so the Prime Minister will begin his year by promising a host of reforms to address them, including making millions more appointments available and faster referrals, all with the goal of cutting a waiting list that currently stands at more than 7 million outstanding appointments by the end of this Parliament. His political health, as well as the nation's, may rest on some of it working. Paul Kelso, Sky News.